Hey y'all, welcome back. We've gotten to getting some good responses on these videos. We sort of realized that maybe we needed to take a step back and just talk about, answer some questions, some sort of common questions that we get about what is it like to get into treatment, acupuncture, and Chinese medicine. So we're going to try and answer some of the most common questions that we get. This is going to be a longer video, which means it'll probably turn into a little mini series of its own. So we're just going to let it flow here, and then we'll cut it up and edit it as needed and release them, release the individual videos over time. So Erin is our office manager, and she is going to ask some of these questions, and we're just going to kind of do this in an interview format. Erin.
So, Tony, if I'm coming in for treatment, what does the initial visit look like? What can I expect for that first visit?
Yeah, the initial visit is a bit longer of a visit. So we have 90 minutes scheduled for that. And that allows us, that gives us plenty of time to go over your whole health history and to go through the paperwork that you've brought in with you. Hopefully you've brought in with you. Paperwork's quite extensive. And, you know, the most important thing about that initial visit is we really want to get a picture of the human being that's walking in the door. Chinese medicine is a medical system. It's not a modality, which means that we rely on a clear diagnosis to guide our treatment plan. And Chinese medicine is a little bit different than other medical systems in that, you know, for instance, we talked about migraines last time. 3 different patients might walk in with migraine headaches. They may all walk out with 3 separate diagnoses and therefore 3 separate treatment plans. It's kind of a joke in Chinese medical circles when people say, oh, do you treat migraines? Do you treat anxiety? Do you treat insomnia? No, I don't treat any of those things. I treat human beings who have migraines. I treat human beings who experience anxiety. I treat human beings who experience, who have a hard time sleeping at night. So migraine headaches, even though that may be the chief complaint, is just one of a constellation of many symptoms that I need to take all of that into account so I get a clear picture of who the human being is and why that person is experiencing migraine headaches.
Awesome. So I've come in, I've got all this paperwork that I've filled out. What can I expect in the initial treatment? Once I actually go back to the treatment room, How's that going to go?
So we're going to go over the paperwork together. If I have any further questions, follow-up questions, I'll ask about those. I just want to chat with you a little bit. I want to hear you tell me about the history of whatever it is you came in for. What makes it better? What makes it worse? And then we're going to use some other Chinese medical diagnostic tools, such as, checking the pulse. So pulse reading in Chinese medicine is its own very specific diagnostic tool. They look at the tongue, things like that. We're going to talk about, things before we even get started with acupuncture treatment. We're going to talk about things that you can do outside of the treatment room. So let's say diet changes you might consider making based on what you're dealing with, exercise choices you may make that may help. And that may be just exercise, the lack thereof, right? You might want to improve that, or you may need more specific help with that exercise. We talk about who might be a good resource for you to talk about how to change your exercise in a way that's going to help your condition. And then, acupuncture, we generally do acupuncture in each session, even in the initial visit. So we'll get on the table and we'll have an acupuncture treatment.
Okay. So after that, is there anything that I can expect to do the next few days, or what can I expect to see in my condition over the next few days, and how long are those effects going to last?
Yeah, great. The ideal situation is somebody walks out after one treatment, feels all the way better, and never has to come back again. That's pretty rare when that happens. Oftentimes it is a process, and so those initial results can look any number of ways. Some people walk out and don't feel any results from the initial treatment. that does not in any way, shape, or form indicate that they will get no results from acupuncture. Sometimes it just takes us a treatment or two to sort of get momentum going in the right direction. Sometimes a patient walks out, feels better for 3 or 4 days, but then after that 4th day, let's say the pain starts creeping in again, that's totally normal too. What we want to do in that case is extend the number of days they get after treatment that's pain-free. And when the pain does start to creep in, we want to make sure that we've reset the baseline. In other words, the severity of the condition never returns back to what it was when they first came in. Some patients might even go a couple of days after treatment not feeling anything, and day 3 wake up and feel improvement. That is an odd response, but not unusual at all. It happens quite frequently. So every patient responds a little bit differently. We just do our best to follow that response and respond accordingly.